Hello, and welcome to Politico Live. This is Carlo Martuscelli, and I'm a health reporter on the Politico Health team, and I'll be moderating today's event. Today, we're talking about tackling mental health in the post-pandemic recovery. This event is part of the Evolution of Healthcare series, and we'll be discussing the impact of the pandemic on mental health and how policymakers are formulating a response. We know that the social restrictions imposed by COVID-19 have had a dramatic impact on our social lives and our well-being. At the same time, the topic of mental health was already gaining in prominence before the pandemic, which has also served as a catalyst to try out new technologies in response to the restrictions imposed by the virus, changing our understanding of how we approach treatment. School closures, obstacles to socializing, and distance learning have all had a dramatic impact on the well-being of children and adolescents, and these are things we're only starting to understand now. So we'll be discussing all of these issues and more. But first, I'd like to thank our sponsor, Janssen, for making this event possible. I'd like to, of course, thank all the viewers who have tuned in to watch us online. And, we like to make these events interactive, so please do log into Slido to ask questions. And you can do that by going to sli.do and inserting the hashtag #EvolveHealthcare. So you can go to Slido from your computer or phone, and if you put that hashtag, you can ask questions. I'll be putting these questions to the panelists once we get to that part of the discussion. And we also have a poll. So the poll is, in order to address the existing unmet needs in mental health, what should we focus on? And the possible options are: increase funding and build an integrated approach to care, raise disease awareness and continue to fight the stigma, promote research and development, and accelerate access to innovation. So please do answer the poll as well, because we'll also be discussing that in a little bit. But first, I'd like to introduce Martin Price, Vice President, Health Economies, Market Access and Reimbursement in Europe, Middle East, and Africa from Janssen Pharmaceutical Companies of Johnson & Johnson. So Martin, thanks so much for joining us today. Over to you.
Good morning, Carlo. Good morning, everybody. It's an honor and a privilege to be here today to introduce this seminar on this critically important topic of tackling mental health in the post-pandemic recovery period. So Carlo also introduced me, gave you my job title. On a professional level, I've been involved in research and development in mental health during my 20 years at Janssen, and I'm originally a pharmacist by training. So I just wanted to give a few opening words to set the scene for this important debate this morning. So we know that mental health is a huge burden for Europe. Pre-pandemic, mental health disorders affected around 120 million people in Europe. So that's about the same combined population as the UK and Italy. And we know that since COVID, the number of people reporting poor mental health has tripled. And some are calling it the silent pandemic with good reason, because the burden of mental health disorders is unquestionable. Compared with the general population, people suffering from mental health conditions have a reduced life expectancy of between 10 and 20 years. And there's also a huge economic burden. In 2015, mental health disorders were estimated to cost Europe around 600 billion euro. And this is due to social security payments, it's due to indirect costs, and it's also due to absenteeism and productivity loss, as well as healthcare costs. And we know that the pandemic over the next period of time will only drive this higher. If we look at depression specifically, pre-pandemic, it accounted for about 1/3 of all mental health disorders. And from March 2020, the OECD reported that these rates have at least doubled. So there's very clearly an existing unmet need that is only being compounded by the pandemic. And as Carlos said in his introduction, I think we all agree that we need to tackle this. We need to be proactive. In 2016, the World Health Organization also reported that actually tackling this is a good thing to do for society and would provide adequate funding and adequate reimbursement, would provide a 5 times return on investment by 2030. So it's a good thing to do. But we know currently countries are not there. Only about 5% of healthcare spend on average is allocated to mental health, which we know is below the WHO target of 10%. So what can we do? Well, from my perspective, there are a few kind of elements that we need to think about, and Carlo alluded to some of these in his introduction. First of all, we need a recognition of the burning platform. We need to recognize that the costs of mental health disorders are huge and will only grow. And therefore, when we look at those costs, we have to, as a society, start to tackle them. And we also know that mental health is one of the highest and leading causes of disability for patients, for people across Europe. So both from a kind of human perspective and also from an economic perspective, we have to do more. Secondly, I think the key here is integration of services, an integrated approach where stakeholders work together to tackle this. We need medical, social, and employment agencies to work together. And we need initiatives such as workplace employment programs, education programs, so that we can help people recognize the symptoms in themselves and in others. Because I think with a lot of mental health conditions, it starts with awareness. We also need to make sure that help is extended also to patients and their carers, because we know that the burden of depression goes beyond the patient and affects those around them. We also, I think, need to continue to destigmatize these disorders. I think we've come a long way, but stigma is still attached to mental health conditions. And so we need really efforts to increase understanding and help remove barriers, and I think get people talking so that they feel able to seek care and seek the treatment that they need. And finally, I believe we need to do more to promote research and development and accelerate access to innovative treatments. I think it's fair to say scientific developments in the field of neuroscience have been complex, and we haven't made the kind of strides in this area that we have in some other conditions. So we face challenges with clinical trials, including issues such as the fact that mental health conditions are quite individual in how they affect people. So we get heterogeneous impacts, heterogeneous response, and it makes clinical development quite a challenging process. And over the past decade, almost a third of regulatory applications to the European Medicines Agency for new treatments has been rejected or withdrawn. And once we get them approved through the European Medicines Agency, they also face a very hard time through HTA processes as well. So we need to do more to help adapt our processes and recognize the specifics of mental health and make sure that we can get these innovative treatments to patients. So investing in mental health is long overdue, in my view. An action plan requires collaboration between stakeholders. And I think, we all have friends, neighbors, colleagues, people we know and love who are struggling with their mental health. And I'm sure some of us on this webinar this morning are also suffering. So quite simply, it's time to act. So thank you very much, Carlo, and I look forward to the discussion.
Thank you, Martin. And we'll certainly be returning to the points you brought up in just a minute. But first, I'd like to introduce the panelists in our panel discussion. We have Francesca Colombo, Head of the Health Division, Directorate for Employment, Labor, and Social Affairs at the OECD. We have Hilkka Karkkainen, President, Gamian Europe. We have Eduard Vieda, Professor of Psychiatry, University of Barcelona, and Chair of the Department of Psychiatry and Psychology, the Hospital Clinic of Barcelona. And we have Maria Walsh, MEP for the EPP from Ireland. So thank you all so much for joining me to discuss this very important topic today. I thought just to kick things off, we could start with a lightning round, a question, and I ask, just a very brief 1-minute response from each of you. So the question is, and this is connecting to what Martin mentioned about it being time to act, I thought we could start with policy right off the bat. And I want to ask, do you think that COVID-19 has served as an obstacle or a catalyst for changing how policymakers approach mental health? So Maria, maybe we could start with you, and then we could go to Eduard, then Hilke, and then Francesca. So over to you, Maria.
Absolutely, and good morning, everybody. I'm an optimist, so I'm going to say it was a catalyst, but a catalyst of great change. But we are at that crossroad now where if we are going to develop a stronger policy that ultimately protects the citizens that Martin just referred to, and we will refer over the next while with you here at Political Live, then we need to ensure that we are taking this catalyst in an opportunist way and funding non-legislative work, legislative work, and best practices right across the EU.
Great. Well, it's always nice to start out with some optimism. Eduard, do you agree? Are you optimistic?
Well, I'm optimistic, but I feel disappointed quite often about my optimism. But I would say that I also see this as a challenge and an opportunity at the same time. So indeed, I think at this point, most politicians, stakeholders have become aware that mental health is important and underfunded by all means, in terms of healthcare and also investment in research and education. And I think we'll have time during the discussion to tackle on those items, because it's extremely important that we actually focus and actually do all those promises.
Great. So we have two optimists, one maybe a little bit more begrudging than the other. Hilke, over to you.
Thank you, Carlo. Well, it is clear that the COVID-19 pandemic has put the spotlight on mental health like never before. And it's really a good opportunity to raise awareness and ensure that action is taken to address mental ill health in effective way. I have to say that I'm a little bit pessimistic because I've been with Gummy in Europe for more than 20 years, and we have tried to make it clear that spending in mental health is not an expenditure; it's an investment. And so, like we already heard, it's one euro spent to mental health brings back 5 euros to society. So I think that that should be realized. But there's been a lot of talk, and I have not seen very much action on this matter. So, well, I hope that people's eyes are open, especially politicians realize that now it's really time to act and do something, because there's been agreement on that we are facing a mental health pandemic in the consequence of COVID-19.
So it seems like we're getting increasingly pessimistic. Francesca, what do you think?
Maybe a mix. I have both optimism and pessimism. In terms of optimism, very much agree that the awareness has gone up. There's much more talk and open talk about mental health, illness, the fact that this can happen to anyone at any moment of their life. And possibly this will help addressing issues like stigma and making sure that this is more on the policy attention. But there is a question of where do we go from this, to this maybe having more awareness to making meaningful change. So are we going back just to normal, knowing that the normal prior to pandemic was not perhaps the most optimal situation that we had? So are we going back to normal, or are we going back to a new normal, which is a much improved set of services, of investments, and support? There are some things which have come with innovations, the digital services, for example, much more use of internet-based solution and support. Are we leveraging on those innovations, but not in a way that somehow, leave on the sides the in-person services as well? Because we know that mental health needs to be very much in-person centered. And more generally, I think COVID has been a catalyst for lots of thinking in health. But the question, as we'll be also dealing with, the debts, significant debts the countries have incurred to address COVID-19, what will be the medium longer term future in terms of investments and in terms of keeping this on the agenda?
I think that financial point is really interesting, and maybe one that gets left out of the discussion sometimes. Obviously, we can have all the good intentions in the world, but if we don't have the resources, then it is difficult to address these questions. We'll be returning to all of that shortly, but I'd like to take a step back from policy for a minute and just try to get a better understanding of the impact of the pandemic on people's mental health, to set the stage, if you will. So, Hilke, I know that you've been doing some work trying to understand how people are feeling. In the past 18 months, obviously we've had 2 lockdowns, we've had COVID-19, this situation none of us had ever experienced before. It's been, I think it's fair to say, a very stressful time for a lot of people. So, Hilke, can you tell us what the findings of the survey you conducted are, and are there any results that jumped out at you or surprised you?
Thank you. Yes, Gambian Europe really carried out a major survey on impact of COVID-19 on people already living with mental ill health, and that survey was conducted last autumn, and the results were launched in May this year. You can find the survey on our website. We got more than 500.
Oops. Okay. It seems like we lost Hilke for a second. Oh no. Hilke, you froze for a second, but please, back to you.
Okay. Yeah, okay, we got more than 500 responses, and about the results, so just over half of respondents said that their mental health had become worse since the outbreak of the pandemic, and almost 60% experienced a decline in their mood during the pandemic. 1/5 of the respondents reported that they were unable to access mental health services, and almost 40% of those said that it was because of a fear going to a treatment center. And there was 60% that reported a change in the way that they received mental health care, which had switched mostly to phone consultations or digital consultations. As to support during the pandemic, a really big number 85% of all respondents said that they received most of their support from family and friends. Also, self-help groups and support from peers were noted as an important source of support. Also, there was there were problems with physical health. So 45% of respondents had pre-existing physical health problems, and a third of these respondents said that their physical health had deteriorated at the start of the pandemic. And 1/5 said that they were unable to access general health services for their physical problems. So these are some things that I raised from but the whole survey is on our website, so you can look it from there.
That's great. Thank you, Hilka. I mean, those are quite shocking numbers. Very, I think it's fair to say quite negative, but maybe not a surprise. I mean, it seems to match what we've experienced in these past 18 months. One number jumped out at me was that 80% of people relied on family and friends in terms of mental health. I wanted to pass that over to you, Francesca. I wanted to ask, obviously you also have your ear close on the ground. You're seeing how governments are reacting. What has been the government response from among the OECD countries, and do you have any data regarding the government side of things?
There are some data about patchy, but it's quite clear that in all the countries there's been a response in terms of organizing services. I mean, it has been mentioned mainly the accelerations in more online digital tools, and this has been the bulk of the response. Trying really to provide support, including through services where people can self-assess their own mental health status. I think it was in the Czech Republic, and then receive also online support. So quite a lot of accelerations of this type of support. At the same time, there have been quite significant disruptions to like services which are services in non-specialized settings. Clearly, obviously, what is delivered in school and workplaces, obviously, because school and workplaces were affected as well. But those services are particularly important because, and that's something that we really work on and trying to put the emphasis very much on. It was mentioned at the beginning by in the introduction, the importance of an integrated mental health approach is not just what the health service deliver, but it is also the whole type of services, including what happens in school, what happens in the workplaces, and all of those have been very much disrupted, and possibly, there's been less of a response in those settings. So it's a mixed bag of responses. Certainly there is awareness, and certainly, in terms of the accelerations of some of the more digital solutions, there have been changes. But there are other areas, particularly in other sectors, in non-specialized settings, in which the response has been more lagging behind.
Great, thanks so much for that. I think we have a nice macro picture so far. Now I'd like to narrow in on what the professionals and experts in the field are doing. So this next question I want to bring over to you, Edward. Obviously you're an academic working in the field. I must imagine in a sense that COVID-19 is maybe a big experiment in a way. We've never locked up so many people in their houses on such a global scale, or I shouldn't say locked up, asked them to stay at home. So I want to ask, what are your findings, and have there been any surprises from the public health measures like social distancing and lockdowns?
Thank you. I think I said that I'm a disappointed optimist, and honestly, we already published some papers anticipating many of the things that have happened because there have been precedents, not in the same size and the same type of pandemic, but we knew that isolation, general stress and fear of contagion, and that the bereavement, because many people died in isolation itself in the elderly, but also the restrictions on freedom on the young, and also the difficulties for accessing mental health care would cause a lot of problems. And we anticipated that, and nevertheless, it's been difficult to tackle. We hope that it will be done, and for that, we know now that the numbers are quite high. We did a large survey across Spain, and also been data all over Europe showing an increase in anxiety and depression, up to more than 40 or even 50% of the population showing some symptoms, which is not the same as saying that they have a disorder, but symptoms of anxiety and depression, problems with sleep and others have been quite prominent. And now it's the time to actually solve those problems, increasing healthcare access, increasing the number of professionals, which is now a big issue in some countries where people are not very well paid and professionals have been extremely distressed. We've seen a lot of post-traumatic stress disorder and other problems related to work overload during the pandemic. So there are a lot of things that we need to do. As I mentioned, this is a challenge, but an opportunity. And I hope there'll be investments to solve all these problems related to the general population, but also to particular sets of the population, the young people who are very sensitive to restrictions of freedom, and also to the people who are mentally ill, as mentioned before by Hilke and Gamian. So hopefully, and then education. I think research and education are prominent. I think we can discuss this later, but hopefully we will do more research and more education on resilience, on fighting stigma, and I hope also on precision psychiatry, which will overcome the problems that were mentioned by Martin at the beginning in terms of how to improve research and finding new treatments and new therapies, not only for the more severe patients, but also in general for the general population.
Great. So on the topic of solutions, I want to return to policy, and I want to go over to you, Maria. What is the European Parliament doing on this issue? And can you speak to us a bit about the work that you've been busy with so far on mental health?
Yeah, absolutely. And, can I just say, and I should have said it from the outset, conversations like this, partners like all the panelists here, like Political Live, certainly allow, and dare I say, push or encourage those that are following anyone's platforms here to begin to look at their own mental health and then their wider audience, be it a workplace or an education stream. So from a policy side, this is also improving the visibility of mental health when we step into be it any of the institutions or at national level or European level. From an EU policy specific space, frustratingly, mental health is obviously not seen as a competency of the European Union, which then allows that grey area of not dedicated legislative work to take place. However, I work with two of our mental health interest groups within the Parliament, an alliance and a coalition, one which we work with Gamian very, very closely, so Hilke's crew. And it's a case that we're constantly making sure our legislative work always has some element mentioned in it. So under the Liberties and Home Affairs Committee, we, my office in particular, consistently calls out for mental health supports for vulnerable citizens in reception centres. Within the Employment Committee, we are constantly looking at and calling for mental health supports within the world of work. So the right to disconnect, how that space looks like now. And I'm really proud to be appointed recently the rapporteurship of an employment file around mental health in the digital world of work. This would be a non-legislative piece, but a great body of work to consistently highlight and bring in the likes of our Commissioner for Health, or even our own President Commission, who I'm really proud Sully has shared in other events that they understand mental health is a core and a serious topic. So how do we bring that in? I mean, fundamentally, though, what we need, and I'm working with MEPs right across the political house to call for this is a mental health strategy, a dedicated strategy. We are also calling on an EU year of good mental health, which I think is fundamental in continuing to raise mental health concerns and issues right across the EU. And then just to add some color to this, because sometimes I think we get comfortable in the policy world to say there is a problem, but we don't have a direct solution. So let's just keep talking about the problem. And as a relatively new MEP, this is extremely frustrating. But in Australia this week alone, they adopted a world's first federal children's mental health policy. That country has also increased 10 free talk therapy hours to 20. So it is achievable. I'll quote Hilka's homeland of Finland, who tested a number of pilot projects about bringing vulnerable language at a younger age into their school system. So at a European level, we can keep pressure on and keep attaching policy. We can make sure legislative pieces is there if we can get it there. Non-legislative is, dare I say, very, very important within this space if we don't have a competency. Blueprints, best shared practices, the use of telehealth and how we can, as an EU-wide, under the guidance of and the umbrella of digitization, really bring those elements too. It's heartbreaking for me to understand here in the west peripheral of the EU here in Ireland, in the west coast of Ireland, that we have nearly 46,000 adolescents. So based on the WHO, that's 10 to 19 years of age. That's 46,000 adolescents who unfortunately die by suicide every year. If we're going to compare that to any university, I think that's PISA is a little bit over that. Our former member state, the UK, that's even more than what London and Manchester has in their universities. Hell, if you even bring it a little bit closer to home in the Brussels bubble, 46,000 people is more than what any of the EU institutions hired collectively. That is a fundamental issue, and we are only doing a disservice to younger people and generations ahead if we are going to continue to not highlight it, not talk about it, not fund it adequately. I was super, super delighted and excited to see our President Commission dedicating EU Year of Youth next year, starting 2022. Hopefully we'll get a EU Year of Mental Health right after that, because the Eye in Strasbourg this weekend, 4,500 young people came to Strasbourg from right across the EU. Every event that had any sort of element of mental health was oversubscribed. Myself and my Maltese S&D colleague, Cyrus Engar, hosted an event with the EU Mental Health Youth Forum group, an amazing group, oversubscribed by hundreds of young people. That's a fundamental visual aid that mental health has to be a part of our work. So in many ways, we have a lot of smaller bits going, but we need to continue to keep pressure on from a policy side of developing an EU mental health strategy in conjunction with an EU mental health, a year of good mental health.
Well, I think it's great to hear that the topic is arousing so much interest in Brussels, and it does hear that it does seem like maybe things are starting to move. I'm also glad that you brought up the examples of Finland and Australia, because I think one of the great things about the European Parliament is that it is a forum where people from different countries can come together and exchange best practices. On that topic, I want to ask Francesca, are there countries in the OECD that stand out in terms of best practices? And, where should we be looking at if we want to learn about what the state of the art is in terms of policy?
Look, I always get the question, like, what's the best even health system in the world? And there is no one country that stands out on all sorts of indicators, but there are countries that have put much more on the agenda issues related to mental health, the investment in mental health, the response to the crisis as well. So some of them have been mentioned. Australia has done quite a lot in terms of really addressing also the innovations in the type of services and the integration. The UK has done lots of investment also in addressing stigma with time to change, and also promoting behavioral psychological services. The Nordic countries, of course, Finland, but also Norway. Norway, I think, is the country that has the highest level of spending on mental health. So there are some here and there, examples of good practices. I guess the issues that remain is how to make sure that mental health is really addressed in an integrated fashion across different level of governments and across different parts of government as well as society. And I think on that we're still very much lagging behind. If you look even at the work, the word of work, for example, there is still little in terms of integrating mental health services into work, and particularly an issue at the transition. So that, for example, the school to work transition, or for people who had a mental health illness or who were perhaps also out of work because of that, the return to work support services and support. So I think, yes, you do find examples, and I mentioned some countries, but still quite a lot to be tackled, and I would particularly single out the issues of the transitions moments in life of individuals, and the integration of services across governments.
So there's one issue I want to discuss that we haven't touched upon yet, which is the one of children and adolescents and the impact of COVID-19 on them. And now my assumption is that there is that these are two different categories in terms of mental health. On the one hand, you have adults, people who have really started their own lives, have careers, maybe are married. And on the other hand, we have people who are still developing. We have children, little kids, or teenagers, and that the pandemic has impacted them in different ways because they're at different stages in their life. Edward, I wanted to ask you, is that the right way to think about it? Are these two different categories?
I think there are different categories, and I think that, of course, teenagers are very sensitive to some of the measures that were taken by most countries in terms of lockdown and restrictions. So they've been, in our numbers, clearly they've been the most affected, but it is also true that they are the ones who are more open to demonstrate it and to complain, whereas the very elderly sometimes are isolated and do not have a strong voice as the young people. But it's true that by all numbers, in terms of increase of certain conditions such as eating disorders, anxiety, self-harm, suicide attempts, in many of these things, the young are showing that they've been very much affected. So we need to put some emphasis on them. We need to make sure that we actually care for them. I think we need some educational efforts in resilience, which means that the ability to cope with stress and coping strategies. We need education on that. I'm not sure that the educational systems are actually tackling on that. Of course, the pandemic was unexpected, but this is an opportunity again. And I think we need to provide better care. I think in many countries, the care, mental health care for adolescents and young people is still underinvested. So we need more investment, we need more education, and we also need more research, because children and adolescents are not small adults. They are different, and they have their own needs. We need to be sensitive on that.
Great. Yes, the point is very much taken. The issue of stigma has come up now several times throughout this discussion. It seems like mental health is less stigmatized, that we're discussing it more, and that seems like a good thing. But Hilka, I wanted to ask you, you're I think it's fair to say you're an activist, you work in the field. How has the issue of stigma evolved, and do you think people are speaking about mental health more freely nowadays?
Well, I agree, that's true, yeah. But in a way, I think that we should change the way we approach mental ill health in the whole world. In fact, because I think that we should be more proactive instead of being reactive. What I mean is that that we should like Edward already said, that we should make sure that that children and adolescents become resilient and they can cope with stress and difficult situations, and this can be already taught at schools like we have here in Finland. In our school curriculum we have mental health skills education, and I think that's very important. And it's also comes, you know, if you do that that kind of education from children and adolescents, starting from there, it, you know, there are less mental health problems. And because now the situation is such that we are waiting until people get ill, and then we start medicating them, and there's not enough research to get new ways of coping with mental ill health. And the thing is that then it's very often it's announced to be a chronic disease, and you will be put on medication for the rest of your life. Okay, in some cases that is probably important, and it shouldn't be stigmatizing, because people with diabetes are on medication for the rest of their lives. So, but yeah, so. I think that we should change the way we approach mental ill health, become more proactive.
So I want to take that point you just mentioned on resilience, because I think it's really important. It seems like one threat to our, I guess, resilience, especially for young people, also to connect it to the question I asked Edward, is the threat posed by social media platforms, by the internet. You know, the constant pressure that we have. And I think the Wall Street Journal recently had an investigation that showing that people in Facebook knew that Instagram, for example, was having a negative impact on the mental health of young women who used the platform. So, Maria, I want to ask you this question, because you're a public figure, you're in politics. I presume that you're quite used to using these digital tools, and you know both their advantages and disadvantages. You know, how do you think we should be approaching digital platforms, be it Twitter or Facebook or Instagram, in terms of mental health?
Yeah, and brilliant question, because I think sometimes we forget, you know, I can answer it from a very personal experience side. So you're right, I did grow up with it. I had my first mobile phone when I was in my teens. And that's the generation at 34, that's the generation that I grew up within. But what stepping in from a public role in 2014 here in Ireland, and then into the political arena in 2019, vastly different. We have a tremendous issue with cyber violence and the impact the use of social media has on our lives from a negative standpoint. So shared imagery, intimate imagery, the rise of social media stalking and what that looks like. We're working on files in the European Parliament right now in cyber violence. We recently just passed a gender-based violence file to make it a Euro crime. Within that was elements of online. But at 34, you know, being told to have a thick skin, I can adapt to. You know, I am fortunate to have built a little bit of resilience, given the fact that I'm an LGBTQI individual living within the political space as well in a public role. But there's times when I scratch my head and I think, what are we doing to actually support younger people? And I hear and I agree with Hilke always about resilience, but to everybody's point, are we actually teaching the skills of resilience within the digital footprint also, and to Martin's point from the outset, I think he had said 600 billion euro costing the EU from a preventative care, a reactive care position. I mean, we haven't even touched the surface of what mental health or the mental ill health has been caused by social media. We're hearing of it now, to your point, what Instagram and Facebook in the world, that the conglomerate that is owned there has impacted in terms of algorithms, but we're still not seeing a direct route to the preventative care other than you just take a phone off somebody. But that's not right either, because that is a generation that they, like myself, have grown up in and should be protected within that space. Tomorrow UNICEF will launch a regional report, a regional study entitled "The State of the World's Children 2021." Her Majesty the Queen in Belgium will be at that launch. It's great to see that, as well as our own Commissioner for Health, Stella Kyriakides. And, pulling out from that, one of the main findings of that report will be that governments across the globe only allocate around 2% of health budget to mental health spending. So when you take your question there about the digital footprints, the rise of social media, the impact it has on particularly young girls in terms of violence, in terms of eating disorders, in terms of anxiety, the fact that we have younger people posting a photo, and if they don't get X amount of likes, they remove it, and the time it takes to take that photo is mind-blowing to me, that we are still living in that reactionary space that Martin alluded to, that Hilke alluded to, and everybody else in this panel. So this is my problem. I don't have a solve for this, other than the fact that we need to work together. We need to, dare I say, wrangle in a little bit of our tech companies, understand they have a business to do too, but we need to ensure that we don't see triple, quadruple of that 600 billion that Martin referred to at the start. That means we have failed in every sense, be it online or in the physical world.
And I think this is a really important question, because it seems like we don't fully understand yet the impacts of these algorithms, what they're doing to our brains. So I kind of want to open it up to the panel. Does anyone want to weigh in on this question of social media and algorithms and how it intersects with mental health?
Can I just add, and I should have added from the start, I agree with every panel, particularly Edward, when he said about research and innovation and the space around. We have a number of leading universities and third levels, as well as bodies out there, but we're not adequately funding them either to do this research in order to be able to even have more honest and info-led debates like this, because we simply have always lived in that reactionary world. So I just wanted to add that piece of as a policymaker in institutions, we need to do more in order to provide more space for everybody else to do their job in order to protect us in the future. I meant to add that there. Thank you.
Maybe one thing which I wanted to bring in, because obviously we know all too well the danger of social media for mental health and the cyberbullying and everything that we have just heard about. But there is perhaps also an opportunity, and the question is how also to try to use the opportunity that digital tools and including the part of being connected can offer for providing better type of support and services. Obviously for young people who spend an awful lot of time online. I think on average, we look at some data some years ago, and it was like 2 hours per day and more than 3 hours during the weekend. So it's obviously a lot of part of their life. So how can we provide that for a space where people and younger children and can also discuss topics that affect their lives in a positive way? How can we provide information and support online? There are obviously countries have been moving to offer services like digital cognitive and behavioral therapies, for example. So I guess the issue is how do we address the negative consequences of social media, while at the same time trying to build also this to an advantage for providing better and improved services. We're probably not there yet. I mean, we see more of the negative consequences, but it's definitely something that needs to be worked on.
And I would add that I think that, of course, social media have pros and cons. They've been extremely helpful during the lockdowns. For example, in our surveys, research shows that using social media was really one of the most successful coping strategies for young people during the pandemic, during the lockdowns. And also in terms of the economy, it was, we all been doing a lot of work from home. Even for us who work in mental health care, we've been treating our patients virtually or remotely, and prescribing remotely has been useful as well. So I think, of course, there are pros and cons. And we need, as was mentioned by Maria, also research on this specifically, how to improve even the regulations and the use of social media so we can get most of the benefits without many of the shortcomings.
I think that's really important, and I'm glad you mentioned that, Edward. We should keep in mind that technology, as it relates to mental health, it's often maligned, but things like distance consultations, being able to access mental health services much more easily, even from your home, that is a good thing. Maybe it's not always the solution, but it can surely be part of the solution. So, Edward, I want to put to you a question from the audience on solutions. And they ask, why is it so difficult to implement mental health policies? And why is it difficult to go from words to action? And of course, I understand you're not a policymaker, but you are on the ground, so to speak. So what do you think is standing between these good intentions we have and actually making a difference on the ground?
I think one of the key issues is that for mental health, there is not a single model. Of course, for severe mental disorders, the medical model is the most helpful in terms of that we can treat mental disorders, and we should treat them as we treat, and this was mentioned by Hilke, diabetes or hypertension and other conditions, and not stigmatizing mental disorders as if they were not part of the healthcare system. But on the other hand, they also affect a lot of people who are not technically ill, but just distressed or affected. And then there are many models, and there's a mixture of approaches, from very social approaches saying that if you invest more in employment, for example, you would improve the health, the mental health of the general population, which is only partially true. We also need to invest in research and education, as we mentioned before, and we need to make healthcare more available. And education is a way, because many people have self-stigma, or because the mental health care is stigmatized, they have fear of going to the psychiatrist or even going to the psychologist. They have fear of the medications, which are very helpful, but they are stigmatized as causing dependence and other problems. So I think the education is the first step in order to, what was mentioned, to not only prevent problems, but also to promote good health, including good mental health.
Great. Does anyone else want to weigh in on that, the obstacles to implementing policy? Okay, well, we have another question, which is on the impact of discrimination and systemic oppression on mental health. Maria, maybe this is something you can address. You mentioned you're part of the LGBTQ community. what are your views in this? Are we addressing adequately the interlocking of mental health, discrimination, and discrimination? Yeah.
I mean, sadly, no, not enough. But I think I started out optimistic, and now I'm moving into this space of pessimism. I apologize, but no, in the context of LGBTQI or other minority groups, no, I think we could do a lot more. But how we work together, how we feed into the likes of research innovation, how we ensure that our member states are adequately reporting into the likes of the OECD, how we champion and work with partners like Amy, and like that's fundamental in order to lifting the barriers. From a personal side, I was very supported here in my house with my family and friends in terms of who I am and how I was showing up in this world and am showing up in this world. But that's not always the case. Not every LGBTQI activist, ally, or community member themselves is safe, be it in their own homes or their workplace. So from a policy side, we have more work to do in terms of under the employment committee, making sure discrimination information about that individual is safe and protected under the likes of GDPR, but that we're sharing best practices so businesses, employers and employees can work together at making sure their spaces are safe, as well as in the Culture and Education Committee, making sure the likes of Erasmus Plus is inclusive to all and not just some. And that includes mental health advocates or those that are getting support and treatment for their mental health. And under that, it also includes LGBTQI individuals. As an intergroup member in the Parliament on LGBTQI issues, we discuss everything both inside the EU and outside the EU. And we're not playing our part. Our commission and our council either are not. When you look at the likes of the anti-discrimination directive that has been blocked in the council since 2008, which is, in my eyes, the foundation, that bedrock for all things that we're discussing here under the guidance of LGBTQI, minority groups, women, making sure that regardless of where you're coming from, your mother tongue, your culture, your skin color, your orientation, that you have equality within the EU. And if that continues to get blocked, then that allows for other decisions to be made at national levels, which means we are not playing our part under one of the fundamental principles of the EU, which is solidarity and equality, essentially. But no, a lot more work to do in this space. But to everybody's point, in particular, Edwards, I cannot stress enough how you asked that very important question. But we need to ensure, as a policymaker and those working within the political landscape, that we are calling for further research, funding that research, in order for us then to know exactly where to be further preventative within that space of any minority group and their mental health.
Great. I'm wary that we're heading towards the end of the panel, but before we go, I do want to touch on something that Francesca, I think you mentioned right at the start of the discussion, which was financial resources and budgeting. We all know money is what makes the world go round, and we can only do so much for mental health unless we are adequately resourced to do this. So, Francesca, I was hoping that you could address this point. Obviously, we know that European countries and the US as well have spent tremendous amounts of money in response to the recession caused by the COVID-19 pandemic. Maybe there's the feeling that after spending so much, maybe resources are going to be a little tight in the aftermath. What has been the impact of COVID-19 on mental health, on the budgets for caring for mental health, and what do you expect to be their evolution going forward?
It's a difficult question because obviously we don't have the granular data that I would like to have to address fully your question. Some countries have put more resources, but just because more resources more broadly has been devoted to health, And as part of that, there has been some more resources devoted to mental health. However, there is a more fundamental point, which if we look over time, the amount of spending for mental health has remained pretty stable, not so much in absolute terms, it has gone up, but as a share of total health spending, it has remained over the decades unchanged. And so we might see now a little bit of an increase, but the question would be, will we go back to the previous situation? And while awareness, I would say there's been improvements in awareness, the resource and allocations are not follow through the growth in awareness. And because of growing awareness, there's also more demand for services, demand for more integrated approaches and support. So I think what the future will look like, well, it's more what we hope perhaps than what I have the magic somehow just be able to understand what would be the future, but there will be tighter budgets. And there will be fight for, where do we allocate the resources? Not right now, there's more money, which is going to help, which is good. But what will happen into the future, and keeping on that, making sure that we also understand better the cost effectiveness of the different services and understand really the returns of investments, keep on emphasizing that the return on investment in mental health is not just in terms of health outcomes, but also in terms of employment outcomes, educational outcomes, and this whole of society approach is fundamental. One last thing, maybe, as I have before, we measure so little in mental health. It's one of the areas in which we know very little. We know a little bit of what is spent. We know outcomes measures such as suicides, and rest we know very, very little. So there is a huge agenda here in measuring mental health much better, including patient-reported outcomes for mental health services. Yeah.
Great. Thanks so much, Francesca, and thanks so much to all of the panelists that joined us today. There's so much more we could discuss, but we are at the end of our time. I think we hit on a lot of important points today: the impacts of social media, the promise of technology, the work that Parliament is doing, how to destigmatize mental health. And maybe the main takeaway in all of this is just, as Francesca said just now, that we still have so much more to learn, and that we still don't understand mental health all that well. So on a hopeful note, I guess we can say that we'll only know more in the future. And so I guess we have to ask policymakers, invest more in research, and let's make sure we can understand this issue so that we're able to tackle it. Once again, thanks a lot to both the panelists who joined us today, to all the viewers, to the really excellent questions that were asked. Thanks to Janssen for being our partner for this event. We will be having another Evolution of Health series event happening in November. The topic will be, what is the role of governments in medical innovation, a transatlantic conversation. We have a little rhyme there. There's more information on the events page at Politico. And please, I ask the audience, give us your feedback. We need it to make these events even better. And you can send it at live@politico.eu. And stay tuned for all of our upcoming Politico Live events. You can find them at www.politico.eu/events/future-events. Thanks so much to all of you for tuning in today.